Hi, everyone. Thank you for tuning in this afternoon. My name is Andrew Phelps, and I am the Director of the Oregon Office of Emergency Management. I am here today, as I was yesterday, representing the Multi-Agency Coordination Group, or the MAC Group, which is leading the statewide response to the COVID-19 outbreak. I want to start off by answering some questions that we received over the last 24 hours, give a brief update on Oregon's supply of personal protective equipment, or PPE, and then we'll open it up for some questions. But before I get started, I want to say this. Having an adequate supply of masks, gowns, and gloves, these are essential for the safety of our first responders and healthcare workers, those doctors and nurses in our community who are helping to save lives. We know we're currently in a global shortage of PPE, but Oregon is working day and night to replenish these supplies. We're working through public and private partnerships to distribute those supplies to all 36 counties here in Oregon, Oregon's 9 tribes, and ensure that the healthcare workers and first responders have the resources they need to protect themselves and their patients. Some of you have asked how much PPE has Oregon stockpiled, wanting to know how many days or weeks worth we have on hand. It's a really challenging question to answer because that number is very dynamic. PPE isn't sitting on a shelf waiting to be requested by a county or a tribe. As soon as we receive it, we're documenting it and pushing that equipment out to the counties so they can be used in their communities where they're needed most. As of this morning, the state of Oregon has distributed over 1 million gloves, over 10,000 face shields, 400,000 or more N95 masks, and over 50,000 surgical masks. We expect an incoming shipment from the Federal Emergency Management Agency later today to be processed at our Wilsonville Distribution Center. Once we have confirmation that that has been received, I'll be sure to share those numbers with you all. As soon as we receive any shipment of PPE, whether through FEMA or private suppliers, we ship those supplies to each county and Oregon's 9 tribes. We anticipate the delivery to the counties and tribes to be complete on or before April 6th. But even in light of the arrival of additional PPE, I urge all Oregonians to continue taking preventative action. The bottom line is we know we're going to need more. But those of you who are staying home and helping to flatten the curve rather, this is helping extend our PPE supply. By staying in your home, you're helping to flatten that curve. Modeling from the Oregon Health Authority shows that staying home and practicing social distancing is working. Ultimately, slowing the spread of COVID-19 directly helps to slow the demand for PPE. It's important to take a moment to acknowledge and thank the generous donations from Oregonians across the state. To date, we've received 200,000 gloves, 100,000 surgical masks, and nearly 5,000 N95 masks, all from private donations. I cannot thank you enough for your generosity, and I want to assure you all that those generous donations are being put to work protecting the healthcare workers in your community. Now, in closing, you're going to hear me say this a lot, so I want to apologize for it. No, I don't want to apologize for it because you're going to hear me say it a lot, so I'm going to keep saying it unapologetically. We need to stay home to save lives. For those who need to leave the house, those first responders and frontline workers in medical settings, first responders, and those working in essential service industries like grocery stores and at gas stations. I can't thank you enough for everything you're doing. It means a lot to us at the state. We know that you're doing all you can to help us with this response. And as you're taking care of Oregonians, we want to thank you for doing your part to keep the rest of us safe. So now I'm going to take some questions, same way we did it yesterday. So if you have questions, we'll use our webinar technology to get those addressed.
Cale Williams, you have a question?
I do. Hi, I'm a reporter with the Oregonian. Thanks for taking the time to address us. I was wondering what the state's stance on homemade or DIY PPE is, whether that's something that you guys are encouraging, and if so, if there's any easy way for people to donate that kind of thing.
Hi, Cale. I appreciate that. So the question, if you couldn't hear it, what is the state's position on homemade PPE, and is it something that we're encouraging? At this point, we want to make sure that the only supplies that are in our supply chain that are making it to frontline healthcare workers are those PPE, personal protective equipment items that are certified by the FDA. We want to make sure that our healthcare workers have the right equipment to protect themselves, to reduce their risk, and make sure they're not transmitting the disease any further, harming their patients or certainly their families when they go home. As far as other uses, non-medical workers, I think we need additional guidance from the FDA on how this can be used, but we want to make sure that in addition to any homemade PPE or non-certified PPE, we're still practicing social distancing, we're washing our hands, and we're doing all those other things that are going to really make a big difference to keep Oregonians safe.
Claire, you have a question regarding emergency prep.
Yes, hi, this is Claire from the Statesman Journal. I had a question about kind of how far short, if this is the case, has the state fallen of being fully prepared for this pandemic? As an emergency manager, did you anticipate a pandemic of this scale? And what's kind of the delta between what you were prepared for and what you need?
Hi, Claire. Yeah, I think a lot of folks across the country and around the world have been caught off guard a little bit by this. And I'll repeat the question too, for those who didn't hear it. It was about emergency preparedness and sort of assessing the state's preparedness posture to face this particular pandemic. So yeah, I think it caught a lot of folks off guard in that we don't typically have the stockpile of personal protective equipment, ventilators, and some of those other things that we anticipate we're going to need to effectively respond to this pandemic, especially as it extends into the next weeks and months. This certainly isn't an Oregon issue, it's a national issue, and in fact a global issue. I think we can always look and say, we need more PPE. We clearly did not have the stock to address a pandemic that was going to last for months, to address a pandemic that was going to impact the entire US and the entire globe. That's certainly a delta that we're trying to fill by working with suppliers to really manage the supply chain. I'm trying to view this as a supply chain emergency from my perspective as an emergency manager. Anything that we can do to increase our supply of PPE, it's ultimately going to limit or mitigate the impact that it has on the healthcare system. As long as we can keep our doctors and our nurses and those frontline healthcare workers in the appropriate PPE, that's going to go a long way, I think, towards saving those lives, flattening the curve. There's going to be plenty of time, I think, once we have our arms wrapped around this, to do those after-action reports and make some recommendations on ways we can improve our preparedness across the board, not just for pandemics, but for Cascadia earthquakes, for wildfires, for winter storms, all of those other hazards that we face.
Jonathan from the Portland Business Journal.
Hi, so I wanted to circle back on the homemade PPE. So, we heard from a Nurses Association official yesterday that, these are no replacement for the real thing. And you're pretty much saying the same thing. I have to wonder, do you think that Oregonians who are making these are sort of lulling themselves into a false sense of security by trying to make PPE? Would you entrust one of your family members with one of these pieces of homemade equipment, or do you think it's potentially harmful?
Yeah, thank you for the question. The question was again about homemade PPE and how trusting can we be about the PPE that's available. If I'm a frontline healthcare worker, I want something that's been certified by N95. That's what we know. That's what our healthcare system is based on, is using proper tested equipment to protect those folks from viruses like this. The big thing for me, I think, just remains the same. If you're not having those direct patient contacts, there's certainly different opinions about whether or not those masks can help you or perhaps even be more harmful. So I think we want to encourage more than anything else, more than some of the homemade PPE, hand washing, social distancing, and all those other things that are going to mitigate or eliminate your exposure to this virus. That's going to be the most effective thing.
Okay, Dick Hughes.
Go ahead, Dick.
He is self-muted. Please unmute your microphone, Dick.
Dick, we can't hear you, so maybe we'll move on to the next one and circle back.
Amy
Okay,
Green.
I'm unmuted now.
Oh, there we go. Dick.
Hi, Dick.
This may seem like an odd question, but what is it that the media should be asking that we're not? What are the messages that the public needs to hear besides wash your hands, stay home, and those things? I guess I'm asking, are there things we're missing?
Wow. Thanks, Dick. The question was, what other messages can the media help share? What other things besides stay at home, wash your hands, cover your cough needs to be shared with this? I think there's a couple of things. First and foremost, I think for me, again, with the family at home and seeing how they're occupying themselves through the course of the days, not being in school, are some of those behavioral health concerns that a lot of Oregonians are dealing with. This is a very, in a lot of ways, slow evolving emergency or disaster, but it's incredibly impactful across the state. So we want to make sure that the anxiety that I know Oregonians are feeling is being addressed. One of the things that we've requested through the Federal Emergency Management Agency that hasn't yet been approved is mental health crisis counseling. So we want to make those services available. So taking time to check in with yourself, your family, your neighbors, assess kind of where you are from that behavioral health standpoint, and giving yourself a break, taking a step back from all of the social media posts about how impactful this is. You know, there's really some devastating images coming out from places across the country showing how impactful this is, and that really creates a lot of anxiety. So I think the behavioral health piece and checking in with yourself and doing things to limit your exposure to some of this, I think that's going to be really important. And then think about what you have that you can share with your community. We've heard from the Red Cross that blood donations are down. Call the Red Cross, go to their website, see if there's a way that you can pitch in through blood donations. We actually had an Red Cross bloodmobile here at the Office of Emergency Management last week. They did a great job of keeping that facility clean and doing social distancing so that the team here at the State Emergency Coordination Center could donate blood. And I think we had over 30 units donated, around 30 units donated just from our ECC staff. That was fantastic. Check on your neighbors, especially if they're not able to leave their home. Offer to bring them a meal and help those folks out. You know, Oregon has great communities and a great community spirit. We need to emphasize that during times of emergencies or disasters, especially something like this. And then the last piece is something that just really rears its head during any emergency or disaster, and that's controlling the spread of mis or disinformation. You see so many different things about what I'll call snake oil treatments, things that really aren't ever going to work to stop this, but people are trying to make a buck. We see scam artists out there looking to sell people test kits that don't work. Anytime we have a federal emergency declaration, it seems people want to come out and try to sign people up for alleged federal services that can be provided to help people recover, and those aren't legitimate. So if you're getting information, make sure it's from a valued, trusted source. All of our state agencies are putting out accurate information and timely information. And if you have a question, I think as a member of the public, post some of those questions to social media and we'll do our best to answer them. And finally, I want to thank you, our media partners, to help get this information out there. I hope that this forum, as we do these updates regularly, can continue to be a source for timely and accurate information. And your ability to help share some of this information, help with the rumor control, I think is going to go a long way towards mitigating some of that anxiety that I mentioned earlier. I think when folks know that they have good information, they feel better about the choices they're making to protect themselves and their families.
Thank you.
Thanks, Dick.
Hey, Amy Green.
Hi. Yesterday you spoke about trying to get as much PPE as possible, as quickly as possible, having people search out sources. And I should say I have two questions. My first question is, what kind of prices have you been seeing? I've heard stories about N95 masks costing $4.50, $5 each, when I know last year on Amazon, anyone could buy them for $1 each. Is there a price you won't pay? And yeah, what kind of prices are you seeing?
Thanks, Amy, for the question. So the question was, what kind of prices are we seeing on our procurement for N95 masks, and is there a price we won't pay? What I've heard talking to our logistics folks, the Department of Administrative Services, who are handling most of our procurement for the state, prices are in line with what we would expect to pay. But I'd ask you to circle back with the Joint Information Center, and they can provide probably some more detailed information about some of our procurement processes and what we've procured to date. And in terms of a price that we won't pay, again, I'd go back to the Joint Information Center and see if they've had that conversation. I don't think that there's been anything that's raised flags with our procurement folks that have said, you know what, this is above and beyond what should be being paid.
Okay. Second question, I've been reading reports about raw material suppliers not being able to supply the materials and manufacturers not being able to get the materials they need to make PPE. Is that something you're concerned about, that you've heard about, that weeks or months down the road, the supply may just be cut off in large part?
And so the question was about the supply chain and the availability of some of the raw materials to make PPE, to feed in some of those companies and manufacturers who are already producing it. I think I have got concerns top to bottom for the supply chain. You know, we need to make sure that the manufacturers have what they need. I don't know that I have anything specifically on my radar where a specific manufacturer said they can't access some of the raw materials. It's my understanding that manufacturers that traditionally produce this equipment are producing it as fast as they can. There's been a lot of reports by 3M, for example, in Minnesota, talking about how they've been able to ramp up their production to meet this increased demand. So that's what we're seeing, but we certainly need to make sure that we've got our finger on the pulse of the entire supply chain, front to back. So as those issues become more apparent, we can continue to work through channels like what the governor's already been doing, encouraging the administration to authorize the Defense Production Act to help streamline and expedite some of that critical manufacturing.
Thank you.
Thank you.
Rob Taylor, you have a question?
Yes, I have a twofold question. You were talking about getting over the curve, and you're already having trouble getting supplies for PPE. But once we get over the curve and people start going back to work, start going back to school, isn't that going to then cause the virus to start spreading because we're all then in contact? And then at that point, won't we have even more shortage because we have shortage now?
Thanks for that question, Rob. The question was about once we get over the curve, will that just prolong the problem? Or are we just kicking the can down the road on our need for PPE and capacity? I want to take this opportunity, I guess, to really talk about flattening the curve and sort of what that means for us. First, I'll say that I mentioned yesterday, we're in the first few miles of a marathon. So we know that we're going to be at this for quite a long time. And that's why we need to make sure we're sustaining that supply chain and thinking not just for the next 2 days or the next two weeks, but the next 2 months and even beyond that. And when we talk about flattening the curve, you can't look at it as sort of like this pyramid shape where there's a hump to get over. It's really more of these are the worst graphics I think I've been able to show, but it's really more of a gradual tabletop or a plateau, if you will, of infections. So it's almost not necessarily about limiting or minimizing the number of people that get sick. It's about when they get sick. As long as we keep our supply chain moving, we keep bringing in additional PPE, the important thing is that we don't impact or we don't go over what our surge capacity is. We want to make sure we maintain the number of hospital beds to treat those that are sick. So that's what flattening the curve is doing. Instead of having, a third of Oregon's population becoming sick within the course of 3 or 4 weeks, which would totally devastate and overrun our healthcare system, we need to make sure that we're flattening that curve and spreading those illnesses out over the longest period possible, so that we have the capacity to respond, so that our hospitals maintain the number of beds they need to treat those who are sick. We're obviously building up our surge capacity if we're not able to successfully do that or be as successful as we want to be. But it's really about that long range planning and understanding that this is not something that we expect to be resolved in the next couple of weeks.
Thank you.
Thank you.
Any other questions?
Excellent. Well, thank you all so much for taking some time to be with us today. Again, if you have other questions we didn't get to, make sure you reach out to the Joint Information Center and we'll work on getting answers to those questions. And we'll see you again here real soon. Thank you.